Our data is up to date as of yesterday, and I just want to show you this slide to emphasize something that's very important. If you look at the circles there, you will see that to the bottom left, you have a blue, an orange, and a gray, and that is the way the disease is behaving in Lagos. 48% of people infected with COVID have a very mild or even asymptomatic course. Some of them don't even know they're carrying the virus. 35% in orange know that they're not well, but they're not that unwell to warrant them going to hospital, and they can usually manage themselves at home. But the 16% there in gray is severe, and 1% have critical. Now, those severe and the critical are all ideally to be managed under supervision in any one of our isolation facilities. Now, there's a problem going on in Lagos, and that problem is that most people, if you look to the right, you will see the typical symptoms of COVID. Now, these are very, very important because there isn't 9 out of 10 people who have these symptoms will go and treat themselves for malaria first. And this is a problem because by the time we get to know about you, it's usually a week afterwards. And if you are in the severe to critical category, we're then struggling to try and make you better. If you look at the symptoms, cough, fever, shortness of breath, weakness, chest pain, loss of taste, loss of appetite, catarrh. Now, these are not symptoms of malaria. So, yes, if you had fever, I agree, if you have body pains, but if you have cough and catarrh and loss of smell or taste, then, and we're in a pandemic that is actively transmitting itself, the virus is actively transmitting itself in community, then the first thing that we should be doing as Lagosians is, okay, I have these symptoms, it is likely to be COVID. And let me find a place where I can test myself for COVID, and also, if it is positive, test members of my family or people that I work with. So let's remember, in a pandemic where a virus is spreading quickly, if you have any of these symptoms on the right, it is likely to be COVID and less likely to be malaria or typhoid or anything else. Don't waste your time treating yourself for something else. Just find your way to one of our laboratories or our sample collection sites and let us confirm whether indeed you have COVID. Now, if your COVID is negative, then we can look for other things. But if you wait for other things to work before you come for your COVID test, and you are in the severe to critical category, this is where we always have problems. You arrive at Yaba IDH in a very sick state, and we have to spend a lot of time and energy to try and get you better. Whereas if you came earlier, we would have been able to manage you before you developed any severe complications. All right, so let's look at the number of positive cases we're having in Lagos. As you know, in Lagos, we keep our data very, very carefully. And you can see we've done a graph there from June. You're going to get these slides, so don't worry. From June, we've taken it from June to December, and as you can see, June, July, August was when we had the worst time. The largest numbers of cases being diagnosed on a weekly basis. And then we came out of what we described as our first wave. As you can see, in August, late August, September, our numbers dropped dramatically. And then around October, things started to go up again, and that coincides with relaxing the economy, movement of people, opening of schools, opening of the airport, and of course, the social disruption, and then the festive season, all of that started to provide the opportunity for this virus to start to spread again. So this is the outline of our outbreak. You can see in red, the first wave was from April to August, and then there was a period in September where everything calmed down. And I think that Lagosians got a false impression that COVID had gone. It certainly hadn't gone. If you recall, we were still diagnosing numbers every day, although at a low percentage. And then you can see a blip in October, and then gradually as we move into the festive season and the economy opens up and people start coming from abroad, then we started to see a new spike, and that is what we describe as the early phase of our second wave in Lagos. So this is our overall data. You can see there that we've diagnosed close to 29,000. Several have recovered in community. In fact, most people are covering in community because of what I described to you as most people being mild and moderate. So a lot of people have opted to manage themselves at home. And in conjunction with our EcoTelemed, we reach out to you when we have a positivity. We assess your state. If you can manage yourself at home, we give you a prescription or we send you a care pack. But if we notice that you're not doing well, then we recommend that you be admitted in a green box. And those that are admitted in the green box are generally unwell. So they are moderate, severe, or critical. And out of those, we've discharged 2,826.